everybody, Dr. Mark Costes here, founder of the Dental Success Institute, author of the book Pillars of Dental Success. And thank you for joining me this holiday week for this quick video. I had an email come in from Dr. Carl from Sydney, Australia, and he asked me, "Dear Dr. Mark, when is it a good time to bring on an associate? How do I find them? How do I screen them? How do I know if they do good work? Thanks for the insights, Dr. Carl." Well, there are a ton of questions in there, Carl. I'll try to be as brief as possible. I will let you all know that in my history of having 6 successful dental practices, I've probably had 35 to 40 associates work for me, and I have basically made every step in the book when it came to recruiting associates, retaining associates, knowing when to bring associates on, over-expanding because of associates. I've made just about every mistake that you can possibly make when it comes to bringing on associates. But if you are the type of person that wants your business to grow without just your own 2 hands, if you want to think about building entrepreneurial satellite practices, if you want to have more than 1 practice, if you want to expand beyond the capacity that you're at right now, if you want to create more profit, then there's no way around employing associates. And it really is a trick. There is really a formula to making sure that you don't hire an associate too soon, and to make sure that before things get out of hand, you make sure that they're doing good work. And I've been stung by that bug as well, getting an associate that you thought was doing really, really well, diagnosing a lot of dentistry, putting a lot of production out there, and finding out 7, 8, 9 months later that all of their work was coming back. And they're long gone at this point, and you're stuck holding the bag. So there are a lot of drawbacks to having an associate, but if you do it right, it can be a successful venture. You just have to make sure that you plan it out correctly. So the first question that he asked was, when do I know that it's time? My rule of thumb is that I like to make sure that personally in any particular practice, the primary doctor is booked out 4 to 6 weeks with no room in the schedule for new patients. And if that's the case, it may be time to bring on an associate. Now, if you happen to be the primary doctor in a practice, you have to make sure that you calculate whether or not you have enough new patients to sustain both of you. If this is going to be a part-time dentist, if you can sustain yourself without any income decrease, and you can sustain this doctor part-time or full-time, that is something that's very important that you need to calculate. If you are booked out 4 to 6 weeks and there is no room for new patients and they are going elsewhere because you can't get them in a timely manner, then it is time to at least consider the option of bringing on an associate at least part-time. Okay, so you may be asking yourself, if I am at capacity right now and I can't handle an associate? That is when you probably should consider hiring a couple more support staff and extending your hours. Now, there's always the opportunity to open up earlier and stay later. There's always Saturdays. That doesn't necessarily mean that you have to work, primary doctor, the hours that you don't want to work, or extend your hours personally. What you want to do is decrease the number of hours that you're working, maybe get a little bit more efficient and see a few more patients during a shorter period of time, and maybe break that day out to a 10 and 11-hour day. The hours that you want to work, you work. The hours that you don't want to work, then the new associate doctor comes on and works those hours. Many doctors are interested in picking up hours any way that they can. That could potentially mean early mornings, late nights, or even weekend hours. Okay, so that's the first thing. Make sure that the practice can support this new dentist. I've made this mistake where I brought on an associate way too soon, and it ended up really cutting into my personal take-home income, and that wasn't necessarily a good thing. Luckily, I had other practices at the time where I could go to other practices and work, or just take the profit from the other practices to help support me and my family, okay? So the other question was, let's see here. Okay, how do you screen them? Well, screening them is another tricky kind of tricky topic. You want to make sure that you minimize the amount of damage that this potential associate could do, especially if they're brand new to the practice, as far as remakes, redos, or inaccurate or inefficient or insufficient work. Okay, so what we do now in my practice, when we bring on an associate at any of my practices, when we bring on an associate, we have them sign a form that says that they are under basically a trial period. I call it probation behind the scenes. So they're under probation for a 30, 60, 90-day period of time, whatever you see fit, they are under probation. And they understand when they get hired by me that every time they do a restorative procedure, if it is a fixed procedure, crown and bridge, if it's placing an implant, if it's doing composite fillings on anteriors or posteriors, if it's any type of restorative work, my assistants know that they are taking a post-op x-ray every single time during that probationary period. In addition to that, we also plan on meeting once a week, myself, the office manager if necessary, and the associate doctor. We go over full mouth series of x-rays to make sure that they're diagnosing correctly and that we are not contradicting each other as doctors within the same practice. So we make sure that the diagnosis is effective. Now, of course, you have to do your best to, diagnose based on just an FMX. You're not going to be there in person looking over their shoulder, making sure they're doing it correctly, but you can give them the benefit of the doubt. If it's a four-surface amalgam with overhangs, then yes, he was probably right in saying that that tooth needs a new PFM. If he didn't say anything about that particular gigantically ugly amalgam filling with a little bit of recurrent decay under there that you can see on the x-ray, if he said he wanted to do an amalgam patch or a composite patch, you might want to urge him and say, look, it's in the patient's best interest that this patient gets a new crown. And you might want to tell them that you have to inform the patient that the decay is so deep that this one might need a potential root canal, and that needs to show up in the treatment notes, okay? So one way to make sure that you're screening them for a certain amount of time, you review post-op x-rays and you review their diagnoses and treatment planning by looking at the FMXs with them at the end of the week. So we do that once a week. Okay, and then the third question that Dr. Carl from Australia asked was, how do you find them? That, my friends, is another very, very difficult question. I can see where you're coming from, Carl. This is a very, very intricate and many layers of complexity when you're hiring a new associate. This is another really common question that I get. I often look at the GPRs and AEGDs in the area. I have a relationship with some of the people that run those, and if they have a particularly good potential associate that's going to be graduating within a year or 6 months, they usually let me know when those people are about to be graduating, and I interview them. I also put ads in the dental journals and in some of the free publications out there that will list free classified ads for us. I do everything I can to get my feelers out, to talk to other dentists in the area, talk to other of my network of dentists that I have around the country, and I try everything that I can to find really good associates. And in many cases, because I'm always looking to transition in the future, dentists and associates that are willing to potentially be partners in the future with me to some degree or another. Buy in, buy out, some sort of transition in the future. And we usually talk about that in the very early stages, okay? So I hope that helps. I know that there's a lot of complexity to hiring associates. It's difficult to kind of answer all those questions in a 10-minute video, but I did my best. Just a reminder, first of all, happy holidays, Merry Christmas, Happy New Year, whatever it is that you celebrate out there. Happy holidays to all you guys. I really, truly appreciate your ongoing support. I get emails and letters and text messages and comments on my blog almost every single day from people that are thanking me for putting this content out there, the fact that it's totally free. I have thousands of dentists that actually watch these videos every single time we put them out. So thank you so much for your ongoing support. All my very best to you and your family, and I hope that you have a blessed, safe, and prosperous new year, okay? In addition, one final reminder that our 60% off early bird price for our Dental Success Summit, which is happening March 20th and 21st, that expires on New Year's Eve at 11:59 Pacific Standard Time. And after that, the price is going up, and we're getting really close to selling out this event. So we would really love to see you guys there. I know you're coming from all over. We have somebody coming from New Zealand, 3 people coming from Australia, people coming from the East Coast, people coming from the West Coast, people coming from Canada. So I really would love to meet you in person. It's $397 for 14 CE credits in one of the most beautiful parts of the world during this time of the world, Scottsdale, Arizona. So if you guys are interested, please don't hesitate to sign up, bring some staff. We would love to meet you. Breakfast and lunch is on me for both days, and we'll have a really, really good time. The speakers are amazing, and if you haven't checked out the speakers lineup, just click below and you can read through who's going to be presenting at this year's event. That's all I have for you guys today. It might be on the other side of 2014 before I talk to you again. So really, have an amazing holiday season, and we'll talk to you soon. Okay, bye-bye.